Let's not spoil it. Obviously, we covered it to some extent on our site yesterday, but obviously there's some shown benefit for heparin in relation to the infection. Can you walk us back first and foremost to the start of research relative to the drug and in the infection?
Right. Right. Well, so at least what's been seen with heparin, and we've talked with some colleague physicians, is it's basically being used to prevent the formation of these microclots. And that's its anticoagulant activity. That's what heparin is known for. Our work is looking at its antiviral activity and its ability to inhibit COVID infection. And so it's a little bit different approach that we're taking here. Of course, it's been used to treat COVID patients, but late stage COVID. So, either in ICU or after someone's on the respirator when they're forming these microclots. But we're more interested in early stage COVID treatment and maybe pre-symptomatic treatment of people exposed to the virus.
Yeah, that's great. And you mentioned to me just offline before, Bob, regarding the research that started into this, whereas a lot of the efforts that we've made that have now started reporting progress were very reactive. It certainly sounds like despite some setbacks in terms of your team's laboratory being off limits for some time now, you guys had to jump on this and you had some inspiration up front.
Right. We saw the sequence when it came out and the sequence for the virus. And we looked at the sequence for the spike protein, which is important because it binds to the ACE2 receptor. And we noticed in that sequence that it had 3 heparin binding domains. And this is maybe not surprising to us because we've done work on dengue virus and Zika virus, and they also both have heparin binding domains as well. And there are other viruses that are known to bind heparin, like the SARS virus and the MERS virus. They also have these type of domains. So we assumed that this spike protein could also bind to heparin. We tested the binding, and it did bind very, very tightly. In fact, it bound so tightly that it didn't come off. And the other thing interesting about the current virus is that it has a third binding site that's in the furin cleavage domain, which, if it's occupied by heparin, can't be cut by furin, and so the virus can't bind the ACE2 receptor. So that suggests that it might be a good antiviral target, and that's the work that we're doing now. So we've been out since mid-March, and so all the work done for this paper in antiviral research was done before we went out in mid-March. And so we've just been trying to get it published. It's published now, and it's out, and we're continuing to work now that we're going back in.
That's excellent, and this is just fantastic findings, and implications for the field are multifold off the bat in my mind. But if we could maybe kind of go case by case from the spots where this research benefits us most. Obviously, as you mentioned, its role in inhibiting the ACE2 binding is hugely beneficial, as you said, for the symptoms and progression of disease in patients. Is that where you see the first impact?
Yeah, so I also have an appointment at Mount Sinai, and we talked with the Mount Sinai physicians as they were treating early patients as New York's caseload was climbing. And we were trying to get them to administer heparin by lung through a nebulizer. And the physicians really didn't like that idea, especially at the height of the crisis. And the major reason was that when you nebulize something like heparin, the patient is going to exhale nebulized particles, and those particles are going to get picked up by healthcare workers like nurses that are around the patient. And so they viewed nebulization of heparin to increase the risk of the healthcare workers. So they decided not to do that. But we still think lung route or nasal routes are really good. But instead of treating patients that are either on respirators or in ICUs, we're thinking that it should be used as an early treatment before the patient is even symptomatic. And maybe once the patient tests positive, or even before the patient tests positive as a prophylactic. So that's where we're going right now, and we're looking at two routes. We're looking at a nasal route, like a saline-based nasal spray that would prevent infection in the nose, which is actually a route that people don't think about, and also in a metered dose inhaler, where you would inhale solid heparin particles into the lung, which wouldn't cause this, particles like vaporization, like a nebulizer would. And maybe this could be used in early patients, in early treatments.